Hey guys, David the Anastasia here. I'm going to talk to you guys a little bit about individual first aid kits, also known as IFAKs. So these are primarily used by the military, however some law enforcement agencies are starting to utilize this concept as well. What an IFAK is a first aid kit that is designed to address life threats at the point of injury in a tactical environment. The supplies inside of an IFAK are designed to address massive hemorrhaging and tension pneumothoraxes caused by penetrating chest trauma, such as a gunshot wound. First things first, the IFAK is meant to be deployed rapidly by you on yourself or by somebody else on you while pulling from the first aid kit that is carried on your person. So these IFAKs are meant to be carried by every member of your team. In the event that somebody becomes a casualty, you can address those life threats without having a medic or another member of your team need to open up their jump bag or their CLS bag, aid bag, whatever you want to call it, before the scene is completely secure. I do want to put a disclaimer in this video saying that by no means is this a precise how-to video or any sort of formal certification whatsoever. It's up to you to decide if you want to accept the liability of performing some of these critical life-saving measures should the need arise. I do want to point out that a lot of the items inside of this kit are outside of Good Samaritan laws and first responder level of care. But let's take a look. This is the pouch that it comes in. This is the standard military issue IFAK. There are a few other versions out on the market. Definitely find one that works for you and that fits your needs the best. This one in particular doesn't take up a whole lot of space on a plate carrier or on your belt line. And it does feature some MOLLE webbing on the back so it can interface with the MOLLE straps on your setup. On the front there's just a quick buckle. You open it up and you will see that there's a tourniquet on the outside for easy access. Rip that out and you can apply that. That's going to be kind of your first thing you do at the point of injury if you see any bleeding or any blood on the extremities. Check out my other video about how and when to apply tourniquets. That's definitely a good watch. Next thing is the panel. So this panel is completely removable. Some of them have a bungee cord or a lanyard that keeps them attached to the pouch. This one doesn't. It's not really that necessary. It's just held together by Velcro. And this is what you'll find inside. Some of them have a few different items depending on what you get issued or what you buy. Some of them, instead of an A-strap, will have an Israeli bandage. And some of them, instead of compressed gauze, you'll have combat gauze. Basically, the first things you want to take care of are those those life threats, such as massive hemorrhaging, which can typically be controlled or at least addressed by the use of the tourniquet primarily. And then the second one is going to be the use of compressed gauze or combat gauze and an ACE-wrap if it's a junctional wound, meaning your neck, your armpits, or your groin, somewhere that a tourniquet can't be placed effectively. I'm not going to go over the proper way to pack a wound or how to perform a needle chest decompression. Definitely you're going to need to get some formal training on that because especially with the needle decompression you're pretty close to the heart and you're inserting a needle into the chest cavity. If you don't do it properly, a lot of things can go wrong. But we'll go over some of the other stuff. So this right here is a nasopharyngeal airway. It essentially is a path for air to flow. That this gets inserted through one of the right nostril or the left. It's primarily used on the right. Basically bypasses the tongue. So if you're unconscious, sometimes your tongue can relax and occlude your airway. This provides a path for air to pass through into your lungs through your nose if your tongue occludes your airway. There are some gloves in here. Technically, you should put gloves on whenever you have the chance to. However, in a combat environment, that's not really a priority. In any situation, they're typically going to go to a hospital and they're going to get antibiotics and stuff just to take care of any sort of infection. Especially at first responder level, definitely, if you have time, put them on. If not, don't worry about it. It's not too big of a deal. And then, like I said, you've got some tape up here. Very useful for marking, the times of the tourniquet, taping it down, or even, making a improvised occlusive dressing. So that is what this package right here is. So There's a few different versions out. This is just a really basic petroleum gauze. Essentially, if you have a gunshot wound to the chest between your belly button and the base of your neck, it's not a bad idea to go ahead and throw on an occlusive dressing, and that's going to prevent additional air entering the chest cavity, which can put pressure on your heart and is lethal if it doesn't get addressed. The way to address that, it leads to tension pneumothorax, is with this. This is a 14 gauge, 3 1/4 inch catheter. Basically, once you plug the hole, you need to let the air inside the chest cavity escape. Like I said, this is a very dangerous procedure. If you don't know what you're doing, definitely do not do this, because the insertion site is very close to the heart. So if you puncture any sort of major artery or blood vessel near the heart, that person is going to bleed out very quickly, and you're not going to have that casualty for much longer. That's the general items that are carried inside of them. Definitely get some training on how to use them. There's lots of specific techniques, especially when it comes to wound packing and needle decompression, that are very specific, and you need to follow those, otherwise they're not going to work quite properly. The biggest thing you should be worried about in a tactical environment is just getting your tourniquet on. So that was a very brief overview of the items that are inside an individual first aid kit. The biggest thing is for you guys to get some training, learn how and when to properly apply the equipment that is inside of an IFAK. Having the latest and greatest gear isn't going to do you any good if you don't know how to use it correctly. Remember, in the event that you find yourself in a situation where you need to use an IFAK, the scene is going to be very chaotic. Your hearing might be affected, you're going to lose fine motor skills, your adrenaline's going to be pumping, you might get tunnel vision. The biggest thing is to rely on your muscle memory from all the practice that you've done. My military guys, make sure you pay attention during your CLS courses, especially if you're going downrange anytime soon. For my law enforcement guys, make sure you're up to date on your TC3 classes and active shooter courses. And for my civilian people, definitely look into some active shooter response classes. They cover everything from barricading doors to self-defense to basic medical skills. Don't forget to like, comment, subscribe. If you guys have any other questions, just send me a message. And thank you very much. We'll see you next time.